All right. Big changes, or maybe not so big. We're getting ready to find out. We've got some shifting around of administration at ECU Health. It maybe not be quite as much shifting around as it may appear, but our friend Brian Floyd has just been named the chief operating officer. Actually, that's not true either, because he's been chief operating officer of ECU Health, but he's also been president of ECU Medical Center. And yesterday they announced that Jay Briley, who has been in the system for a long, long time — I've known Jay since he was down, I think, in Duplin County — is now going to be the president of ECU Health Medical Center. And my friend Brian Floyd will dedicate his entire time and role to be chief operating officer for all 9 ECU Health hospitals. Mike Waldron will continue to be the CEO. He is also the dean of the ECU Brody School of Medicine. And so I wanted to get Brian on this morning to talk about the changes and what it means. Good morning, Brian Floyd. How are you?
Good morning.
Now,
well.
you've been chief operating officer of the entire system for a long time, but you had a dual role because you were also running the big hospital here.
Yeah.
And did it just get to be too much?
Yeah, I mean, the reality is here, first off, thanks for having us and letting us communicate things to the public so that folks are reassured and understand what we're doing. We want to always be transparent about our activities. But as you know, I've served as the president of the Medical Center for a decade or more now. And over the last several years, especially as we started to creating the enterprise we now call ECU Health, there's just been a growing amount of central management requirements to that. And I would say the tipping point was probably maybe 2 years ago, once we decided to integrate and Dr. Waldron became the dean of the med school. That carries with it an entirely new set of responsibilities for him. And so I then started serving as the COO of our health system. But it's just gotten more and more complicated and more complex, a bigger organization. And at some point, trying to do both of those jobs means that I'm not enough in our medical center. And I just needed to reallocate my team. So Jay he reports to me as one of my team members. Van Smith, who was the executive vice president at the medical center, also one of my team members. And so we've been planning for some time, how do we create the right succession necessary to handle the breadth of what ECU Health is becoming. I will say that our structure that we're talking about here is very common. This is the same way most organizations are structured like this. But at some point, it's really just about making sure we have enough bandwidth and dedication of focus to the various things that happen. Our medical center is going to be as great as our health system can be together. And our intention with all of this is to create one ECU Health enterprise that has the medical school, is partnered with all of our allied health programs, manages our academic medical center, 9 hospitals in the region. We have over 120 clinics that are spread around eastern North Carolina where our doctors practice. And then there are the central services that you don't think about, like information technology and human resources and things like that help make the system work well. And so as my time has been split more and more in the oversight of the enterprise itself, it just at some point became necessary for me to make sure there's a day-to-day leader in the medical center that is making sure the hospital's running well day to day. And as we talk about shifting, coming out of COVID and all the time that we've been so intensely focused on keeping the system going, I started looking at what kind of leadership shifting can we do that would enhance the perspectives the leaders have in creating one ECU Health enterprise. And in this case, both Van and Jay have been CEOs of small community hospitals in the rural environment. Jay has been leading our community division of hospitals in the region and has a perspective of working with those presidents and how that works, what's needed, what are they experiencing, and what's it like in our remote rural communities many times. Van, on the other hand, has been running the day-to-day operations of our medical center and has the perspective of how they receive that from the region. And so my goal was to flip-flop those two jobs essentially and change the perspectives so that we're leading all the organization with full knowledge of how the whole is working.
Yeah.
And also, when you have leadership change, it's a great opportunity to have a new, fresh perspective put to how the team is working, what the day-to-day is like, what do we have in focus, refreshing leadership down into the organization just by having that fresh perspective applied to it. So the best organizations in the nation have a good process of cultivating leadership from within the organization over the years, and we've been about that business for some time.
I'm excited for Jay Briley. For folks who have not met Jay yet, we'll get him on also to talk about that and his new role. But Jay is a very bright administrator, has been in the system, as we mentioned earlier. But Jay Briley will now take over as president of Vidant Medical Center. You mentioned several things I want to hit on. You've been through we've been through so much in the medical industry, especially here in the last few years. With COVID, that changed everybody, but it certainly changed the medical industry. And then Medicaid expansion finally took place last year. And then the change with Mike Waldron becoming the dean of the medical school and the CEO of ECU Health, and the integration of the medical school and the hospital, which we've wanted for a long time, and a lot of people have worked to try to make it happen. It finally happened. So let's start with that. How is that working? How has now we've been down that road for a little while. How is it working to everyone's benefit to have the medical school and the hospital all under one roof?
Well, first off, it's a process we're in. It's not just obviously you feel the brand change, but the real work is underneath all of that as we're integrating departments and functions together. It's very early in the process. 2 years is not long from to say we do this and then we're experiencing what that means.
Yeah.
So there have been several of the practice clinics, let's say, that have now merged together instead of having a former Vidant group and then a former Brody School of Medicine practice plan. In some cases, they're actually now merging together, and we're in the process of bringing them all under one practice. The earliest thing that happened is we revised the compensation plans for our physicians that previously were in the state's model. Now, because it's all one health system, we can use the resource of the system to help make sure we are competitive.
And that's huge, right? Because we keep hearing that we have a hard time recruiting doctors here.
Yeah. We're competing for every person that works in healthcare. We are competing on a national stage for those people.
Yeah.
And we want the best people.
Right.
And so we can't do that if we're not going to pay what's required to have the folks join us. And so one of our early initiatives was to help standardize the compensation philosophy so that our physician practice plan, which is large, there's more than 1,000 doctors in our practice plan now.
Right.
But that there's some standard philosophies to compensation that are competitive in the market. That happened early on because we could integrate. And we've seen a tremendous increase in the number of recruited physicians. Our turnover of physicians has improved. And so those are the early benefits that are happening. Mm-hmm. We're in a process of deduplicating the system. Formerly, Brody was standalone, separate company, separate back office, separate everything. And so now what we're doing is consolidating it under the system, and that there'd be one framework, one IT system, one HR system, one compensation philosophy, all the things that kind of take away the duplication. But all of that takes a lot of effort, time, and attention. Yeah. And so that's kind of what's led us to make these changes is so that we can handle that.
Folks may not realize, ECU, the Brody School of Medicine, when it was founded in 1975, it was founded under the premise that the legislature was going to fund it because we need doctors. And, as Cecil Staten used to say, if the Brody School of Medicine didn't exist, we'd have to invent it today because we're educating the doctors that are taking care of us in North Carolina. But the legislature all of a sudden couldn't really understand why the medical school wasn't making money because Chapel Hill's making money. Why y'all keep coming up here and asking us for money? Yeah. And, that mentality changed over the years, and what they didn't understand was that the UNC Medical School and the UNC Hospital were all under one roof. So putting Brody under one roof with Vidant and making ECU Health, I think, was a very large key.
Oh, it was necessary. And you mentioned the General Assembly. It was strategic. So we did this alignment not just to have the brand be purple and gold, although that we love that. Yeah. We did it so that we're closer aligned to the state of North Carolina, so the obligations of healthcare, as UNC has felt over the years, become part of how we're funded. Right. And you've seen this year in the budget that there's money for rural healthcare that was placed in this year's budget. There's money for the expansion of our medical school, and there's a new medical school facility in this year's budget alone, all of which are coming as a result of us having created ECU Health.
Yeah, and this legislature, the legislative leaders really get it. But, I mean, it didn't come without a lot of effort on a lot of people to try to educate them, including you and Mike Waldron.
No question.
How about Medicaid expansion? It took place, in October?
Yeah, we're still very early in the process of that. And
does it look like the panacea you were hoping for?
Well, we had no misgivings. There is no panacea, but there is the issue of, right now 10%, there are 10% more enrollees thus far, and it's an early process that will continue. And so we don't realize
people may not understand. You have so many people that come to ECU Health and can't pay.
Right.
And so the Medicaid expansion piece was just huge for you.
Yeah, more so for ECU Health than any other health system in the state.
Yeah.
We have the highest burden of indigent care and the highest burden of unreimbursable patients who just don't have insurance and don't have the means to pay for it. And so Medicaid expansion for us was a necessary issue if we're going to stay vibrant here in the East. So there's about 10% more enrollees. We haven't felt the benefit of Medicaid expansion financially yet, just because they haven't come through the health system and had those bills paid at a rate that we would feel.
So you're not getting the cash yet.
Right, but you do remember that with Medicaid expansion, the big issue for us was the HASP system, the Hospital Access Stabilization Program, which is a federal program that augments the rate of pay in the Medicaid population. Those payments actually do have material value to us, and we've already received some of that benefit. That's about $100 million a year benefit to ECU Health. So that we're starting to receive, and it's helping us recover. As you know, we've talked about, we've had 2 or 3 really tough years. So has everyone else, by the way, around the country. But we've had losses for 2 or 3 years now that are, very astounding losses, and those are improving now. We're beating our budget expectations right now than where we thought we would be at this quarter, and so we're starting to realize some financial benefit of that, plus some work that we're doing inside to create some efficiencies in ECU Health through this whole integration process and renewal. So I'm excited about where we are. I'm excited that we're very optimistic. We're actually beating our own projections right now. That doesn't mean that's good enough.
Yeah.
So we're still losing money right now as a health system, but the amount of losses are far less than what we had thought they would be as a result of these changes.
We got a hard break coming in 4.5 minutes. So what have I not asked you that you want to talk about?
Well, number one, these are healthy changes. Organizations that plan for transitions and plan for the future of what you need to operate the system, that's what the public expects of us. And so people like myself and Dr. Waldron and Jay and Van and others we have lots of talent in our system, are fulfilling the roles necessary to keep advancing us to the future. We are a larger enterprise than people think. We're not one big hospital. We're a system. As I mentioned, there's 120 care locations in eastern North Carolina.
All of that now under one roof, reporting to you.
Yeah, well,
You're
me and my
a busy guy.
team. And so obviously with that much intensity, I have about 13,000, 14,000 employees that we are trying to help make sure do their best every day for the East. I am super committed to that. And this was a natural transition we've been planning for some time to create the ability for Dr. Waldron to also spend a lot of time in Raleigh, spend a lot of time bringing legislative support to what we're doing, as well as philanthropic. He's a member of the university's council and all those things necessary to help advance the whole of ECU. And so that means someone's got to manage the day-to-day operations of the health system, and that's where I'll be spending my time.
You still have a nursing shortage?
Of course.
Always.
And obviously I've talked about this many times that we knew, especially through the pandemic, there was a shortage before the pandemic.
Yeah.
30+% of all healthcare workers exited the field during the COVID, nationally, not just here.
Yeah.
And so there's just a giant national shortage now of people. At the same time, hospitals are busier than they were before the pandemic. And so what we're seeing here, of course, is we are flooded every day now. Over 1,000 patients a day just in Greenville, not to mention the whole of the system, but our entire system hospitals are all increased on the number of ED visits, increased above where they were, 6% more inpatients than we had last year even. So the time that you have shortages or the time you have this increased burden of care. And that's what the public is experiencing in terms of trying to access service. And so all of these moves are so critical. But the good news, Henry, is that we are aligned with ECU, where we have the state's largest nursing school. We also are aligned with 5 community colleges. So we are producing the pipeline, not only for the nation and for the rest of the state, but we are positioned to be able to produce the pipeline for what Eastern North Carolina needs through ECU Health right here in the East.
Well, I'm your biggest fan. I've always really appreciated you and the job that you do, and I'm happy that you're going to kind of be at the controls.
I'm still here and not going anywhere, and I'm going to be supporting my team as we continue to advance, and I'm really excited about what this year's got in store for us as we continue to move forward.
I know you have a lot of challenges.
Sure.
And people lose patience from time to time. Not patience, people, but lose their emotional patience.
Yeah, I tell the public, usually the biggest thing folks experience is emergency department waits and things like that. And I tell the public, keep in mind, we are always making sure we're safe first. So the sickest patient is the one we're always going to take care of first. And we serve a 29-county region, bringing people into this, more than 300 and 400 emergency department visits a day just in Greenville. Mm-hmm. And so we make sure we take care of the sickest first. Sometimes that requires waits, and we encourage people to always check with your primary care doctor first and see how much care can be rendered outside of the emergency department, so that we're always ready for those emergencies that we really do need to tend to. But I've seen improvement across every cycle of our performance in our medical center on time delays, on the quality and experience of our patients, and now with financial security, every measure we have is moving in the right direction.
It's good to see you.
Good to see you.
Thank you for coming
Thanks for having
in
us
again. Brian Floyd, who is the Chief Operating Officer for ECU Health. I tell you, 120 clinics and 9 hospitals. You got a big job, bro.
Well, I have a great team. Dan Drake and Jason Foltz oversee our clinics.
Yeah.
Jay on our medical center now. Van will oversee all of our community hospitals. So we've got a really great team, and I'm excited about the year ahead.
Yeah. Well, I'm excited that you're running the show. You and Mike Waldron have done a terrific job. All right. Thanks to Brian Floyd for coming in this morning and kind of talking about the changes in administration at ECU Health. All positive stuff.